Good afternoon, everyone, and thank you for inviting us to come speak to you about our program. My name is Emily Walling. I'm a pediatric oncologist at Mott Children's Hospital, and am so pleased to introduce my team and talk to you about the program that we have created to support adolescents and young adults with cancer. Next slide, please. So why AYA Oncology? So first, let me tell you who we're talking about. So the National Cancer Institute defines adolescents and young adults between the ages of 15 and 39. And so when we're talking about hard numbers, there's almost 90,000 AYAs are diagnosed with a new cancer every year. And when we talk about survival, about 85% will survive greater than 5 years post their diagnosis. So that number looks pretty good until you take a deeper dive into it. So this is very dependent on the type of cancer that an AYA is diagnosed with. So 5-year overall survival can range between as low as a third to almost 100%. And this is due to several reasons, but one of the biggest is the unique distribution and biology of cancers. So there are rarer cancers seen in this age group and more aggressive cancers seen in this age group. And then unfortunately, particularly in the United States, we see pretty significant gender and ethnic disparities that contribute to poor survival. Next slide, please. So AYAs over the past several decades have gained increased attention because for several reasons. So when we talk about overall survival, a piece of that we also look at is how has survival improved over the past several years. So as oncology treatments have gotten better, in almost every age group, we've seen incremental gains in survival every year. But the age group that has not seen those are adolescents and young adults. Contributing to this group also has a greater latency to diagnosis and also lower clinical trial enrollment. And that is very significant because not only do individual patients not have access to cutting edge treatments, but as a whole, we have less information about these patients' diseases and toxicities to therapy. There's also a higher prevalence of non-adherence among the AYA populations, and then this extends to taking oral chemotherapy that is necessary to treat their illness, to follow-up exams, disease surveillance post-treatment, and enrollment in survivorship programs, which we know is absolutely critical to monitor for late effects of cancer therapy. And then finally, most importantly, is the unique psychosocial stressors that is experienced by this age group. So in an attempt to better support our adolescents and young adults with cancer, we have developed this program that I'm excited to introduce our program manager, Beth Stuchel, who will tell you more about it.
Thanks, Emily. Hi, I'm Beth Stuchel. We began our journey to create this program with a little help from our friends. As part of the Teen Cancer America network of hospitals, we have access to a wealth of information from centers who've traveled a similar path. Program managers at these centers are incredibly generous with their time and resources. One thing we heard again and again is the value in engaging and sustaining a patient advisory council. So we got right to work. We met with Michigan Medicine's Office of Patient Experience, who provided guidance and training. We recruited from Mott Children's Hospital and Rogel Cancer Center. Since we started meeting monthly via Zoom in October 2020, the council has established a social media presence and is creating a peer match process, along with ways to provide newly diagnosed patients with age-appropriate items, activities, and resources. I could not be more proud and grateful for our advisors. They're dedicated, interactive, creative, and thoughtful. They want to make the experience of being treated for cancer better for those who will come after them. We also knew we needed to get a good understanding of our current practices and where we can do better. We created a partnership with the Adolescent Health Initiative to evaluate our program and the spaces where we care for AYAs with cancer. We launched patient and provider surveys in April 2021. Once results are collected and interpreted, the real work begins. With a group of faculty and staff champions, we'll use our survey results to create AYA-friendly spaces, practices, and resources. Partnerships with community organizations are vital to our program's reach and sustainability. Having a strong connection with the greater Ann Arbor cancer support community has led us to create quarterly workshops focusing on hot topics for AYA cancer patients, survivors, their partners, and caregivers. Our first workshop, Let's Talk About Sex, addresses sexual intimacy. Other workshops will address fertility, school, work, and the late effects of treatment. When we reflect on this past year, we've learned so much. We launched a program in the middle of a pandemic. It hasn't always been smooth, and we're still figuring out ways to promote the program and recruit patients. We continue to tweak the referral process within our electronic medical records system. And lastly, like everybody else, we're always on the lookout for grants and sustainable funding. These accomplishments and challenges have made our team even more committed to creating a successful program. As we transition to year 2, we're excited about reviewing and acting on survey data, launching youth-driven initiatives, and embarking on research that improves the clinical and social emotional outcomes for teens and young adults who experience cancer. For more on our research, I'm pleased to introduce Anau Jong.
Thanks, Beth. Hi, everyone. I'm Anau Jong, and I'm the Research Director for Patient Services and Outcomes at the AHI Oncology Program at Michigan Medicine. A unique aspect of our program is a research arm that closely interacts with the program's clinical arm. Having the unique opportunity to have a research arm allows our team to translate clinically relevant questions to research questions in a timely fashion. Additionally, we're also able to tackle some cutting-edge issues or topics that are just recently emergent in clinical settings. For example, we just completed a study on evaluating the oncofertility service needs and preferences among AHI cancer survivors, and oncofertility has just recently gained much increased attention as we start to see the importance to confront this issue at the early stage of an AHI cancer diagnosis. We are very pleased to share that Dr. Walling and our team was recently awarded a pilot grant to further dive deeper into oncofertility issues among AHI cancer survivors who self-identify as sexual and gender minority, which is an area where there exists almost no research evidence. The synergy between the clinical and the research arm really enables us to engage in service-informed research and research-informed services. For example, as Beth mentioned, we currently are conducting a need assessment of all AHI cancer patients and survivors who are receiving or have received cancer care at Michigan Medicine. We'll closely evaluate the collected data to inform the continued development of our program. And I would like to conclude the research arm introduction by sharing that we have been successful in reaching out to our peer institutions in conducting AHI oncology-focused research, including MD Anderson, University of Chicago, University of Maryland, just to name a few. And now I will hand it to our Advisory Council co-chair, Alex Dills, to share his perspectives.
Thanks, Anau. I'm Alex, and at the age of 18, just 1 month before graduating from high school, I was diagnosed with acute lymphoblastic leukemia, also referred to as ALL. I immediately began chemotherapy, which consisted of intensive chemo for 9 months, then followed by maintenance for 4.5 years. This caused me to have a high risk for bleeding and infection, so I was forced to limit contact with others. I was unable to walk at my high school graduation, and in those 9 months following my diagnosis, my friends left for college while I remained quarantined at home. I spent months searching for a solution to what seemed impossible. How will I balance my chemotherapy with college? It was inevitable since I had 5 more years of treatment ahead of me. My answer materialized on an autumn day while waiting for an infusion, the day I met Derek. His healthy and resilient appearance stunned me. I introduced myself and learned that despite receiving ALL therapy, he continued to play Division I college football. Inspired by his example, I rebuilt my strength and enrolled in college. I began to balance a full college curriculum with my ALL therapy, creating a new normal life, or whatever normal may have been, that challenged me daily. Low white blood counts prevented me from attending lectures, while nausea and steroids wreaked havoc with my appetite. I contacted Derek frequently to seek guidance, but I quickly discovered that a patient's experiences with their illness are unique to them. As I improved each day, I sadly watched him relapse. Lacking a bone marrow match, Derek passed away 10 months after our first meeting. 2 years ago, my family was struck with the devastating news that another member of our family had cancer. This time it was my younger brother, who was also an AYA. As I watched my brother endure harsh radiation therapies, I reflected on my own treatments and realized there is not enough support for this population of cancer patients. Before I dive into what AYA means to me, I must ask all of you, when you think of cancer and the people that it affects the most, who do you think of? I never imagined that a high school or college student could be affected by cancer until I was one of them. When we were hospitalized as adults, with people 30 to 50 years older than us, or as a pediatric patient, with children who were predominantly young children, toddlers, and infants. As an AYA with cancer, we felt like we were in the middle of two worlds. I learned through my experiences with Derek, my brother, and other AYA patients that the AYA population is extremely complex and everyone is unique, going through rapid psychosocial changes. I was approaching a significant transition point in my life, about to experience for the first time independence and self-exploration. Instead of trying new things and making new friends in classes, I found myself overwhelmed and experiencing the stigmas associated with cancer: guilt, secrecy, and shame. I felt guilty asking for assistance with treatments or extra time on an exam at a time in my life when I should have been receiving less assistance in approaching independence. I would refrain from telling others about my medical condition because I didn't know how they would react, and I didn't want them to think of me as the kid with cancer. Worst of all, I was ashamed of how the medication altered my appearance, and I was ashamed of the scars from my surgeries and the port in my chest. Derek helped pull me out of that and taught me to embrace my cancer and that I am more than my diagnosis. I modeled myself after Derek and taught my brother to do the same. I am grateful for the support that I received from Derek and I could provide for my younger brother. I want other patients to make connections and provide support for each other like Derek and I did. I think that one-on-one mentorship is extremely beneficial for AYA struggling with cancer during this critical transition point in their life. Many would argue differently, but I truly think that I would not have made it through some of my treatments if it were not for Derek. While he did not administer my treatments, he provided me with something invaluable at such a critical time point in my life: guidance and hope from someone who understands. What I want going forward and what I am trying to assist Beth, the council, and Michigan Medicine AYA Oncology program do is create a peer support program and one-on-one mentoring opportunities between patients in remission and those undergoing treatment. I would love to see patients providing support for each other by visiting one another in the hospital, like Derek and I would. That way, there are less feelings of isolation. We can even go beyond this because we live in an age where connections can be made instantaneously over social media, while two individuals stand on opposite sides of the country. I want to take advantage of social media and technology while using matching questionnaires so all AYA patients have the opportunity to receive mentorship. I want to thank you all for listening to us and have a wonderful day.